Most often in a child's formative years, they will have a temper tantrum. Knowing how to deal with this behavior can help a parent take control of the situation. We spoke with Dr. Alexandra Duke of St. Jude Medical Center in Fullerton to learn about the proper guidelines in handling a temper tantrum.
A temper tantrum is, when you think about it, it's out of control. The symptoms are worse than the disease. The treatment is worse than the disease. It's a child who is out of control for no apparent reason. Now, there are reasons, and we will talk about what are the things that sort of trigger the tantrum and what you can do to hopefully ward it off before it even starts. The first thing to do is, if it's a number 1, 2, and 3, is the safety of the child. And then we'll worry about the people around you. But you always want to think about, is whatever the child's doing going to cause them any harm? Because if it is, you've got to stop that. But if it's just screaming in the middle of the room, or if it's lying on the floor in the middle of the room and stomping your feet up and down or whatever, that's not going to cause you harm. If you're hitting something hard, you could injure your hand, or you're hitting someone else, you could cause them harm. That cannot continue. That absolutely requires intervention. And the key thing for the parent or the caregiver is to ignore that. Do not give in to it, because we all learn that if we scream, squeaky wheel gets the oil, right? We don't want to reinforce the behavior. So if the child is safe, let them scream, let them kick, just so long as they're not going to hurt themselves or hurt somebody else, because you do have to look out for their safety. We like to do studies, and we know children who have experienced physical hitting, corporal punishment, whether it's the ruler, a smack on the back end, they have problems. They have significant, many of them, not all of them, but many of them have significant emotional problems. Their acts can lead to criminal activity. There are lots of studies that have looked at that. It doesn't mean that if that is what you and your family choose to do, that that's going to be the destiny for your child, but it could be. So we like to think of other ways besides hitting. In our society, there's this wonderful thing called timeout, and the timeout chair or the timeout room. And if it is that you're at the grocery store and they're throwing a temper tantrum in aisle 5 and it's not appropriate, or they're throwing things at the grocery store or whatever it is, then timeout needs to happen. And that might mean taking your child to the car and putting them in the car with you and sitting there in the car until they've calmed back down. They're not going to get whatever it was that they wanted at the grocery store. They're not going to engage in that activity and saying, I know you're angry, I know you're upset. We're not going to stay in the store. We're going to go out and sit in the car, and we're going to sit there quietly for 2 minutes, maybe give them a 5-minute warning or a 30-second warning, or an extra 15 seconds at the end of that, and saying, you're doing really well. I'm very proud of you. You've calmed down. You're not so angry. Can we go back into the store now? Or you might think that was really bad and I am very embarrassed, and we're going to go home. And then once you get home, it's forgiven. They had their time out. They're forgiven. You're back to hugs and love again. What can you do to make this not happen? Maybe one thing is, think about your child's routine and really stick to it. If they're hungry, or if it's nap time, or can a 2-year-old really sit through Mass? Be realistic at what you expect your children and your child to do, and know your child. If they're just a fidgety, busy little girl or boy, let's not set them up for failure. Let's really think about, what is my child capable of, and plan accordingly.